Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee-infused conversations. What's going on, guys? Welcome back to the Movement PT Coffee Cast. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
Doing pretty good, Dalton. We're doing full Canadian today.
Full Canadian mode.
You got your toucan.
I got my toucan. I got my Tim Hortons with my Merry Christmas cup. And we're talking to a good old Canadian boy.
That's right.
So it's just going to be a Canadian-filled episode. I'm pumped. We got the first snowfall, too, in
That's
London.
right.
It crushed us.
For better or for worse?
For worse. But yeah, so guys, we're back at it again with another interview this week. This week we're interviewing a physiotherapy student from Queen's University in Kingston, Ontario. His name is Anthony Pinto Da Costa. Anthony, how you doing, man?
I'm good, man. I'm good. I'm not gonna lie, it's weird being on this end of the podcast this time, Not listening to it and actually being the one talking, but it's definitely a cool experience.
You sound great, man.
Appreciate that.
So, Anthony, why don't you just start off and tell us a little bit about yourself, who you are, what you're doing right now?
Yeah, so as you guys said, my name is Anthony Pinto Da Costa. I'm a second-year physiotherapy student at Queen's University. Prior to attending Queen's, I was at the rival school just down the road, out there at Western University. So still bleed purple till the day I die. So, but yeah, I took kin there, and I got really interested in just, anatomy, physiology, all that, and decided to go into physiotherapy from there. But if we scale back a bit, I'm also from a small town called Georgetown, Ontario. Not sure if you guys know where that is. It's just kind of on the outskirts of the GTA there, kind of within Milton, Brampton area. And just growing up, played a lot of sports, very active, basketball, volleyball, football, soccer, all those. And yeah, just always been an active kid. So other than that, don't really have too much else to say about me. I'm doing this YouTube channel, but I guess we'll talk about that later in the pod.
Let's step back a little bit in time and think about your submissions into physio school. What were some of the main reasons, like why you wanted to get into physiotherapy in the first place? What drew you towards it?
Yeah, so it's a loaded question because there's so many things, there's so many reasons why, and like looking back, seeing certain life experiences that really kind of geared me towards choosing a profession like this. It all kind of came full circle for me. So I guess I can first start with just kind of my traits, who I am as a person. Like I've always been a people person, always like communicating with people. I've always been active, like I said, and I really like kind of promoting health and promoting exercise with people because it's pretty much my life. Like it's super important to me. And then I guess even going back further, before I wanted to be a physio, I actually wanted to be a teacher or a lawyer. It was kind of between those two. So pretty left field compared to what physiotherapy is, pretty much two different fields. Mm-hmm. And I was just like very interested in history, very interested in law, and I knew I wanted to do something with that. But throughout high school, I always took biology too, because I just always had this keen interest in the human body, but I kind of saw it more as like a hobby, like it was history, law. Those were the two things that I for sure, like that's what I wanted to do with my career. And then just me kind of understanding my body, things like that. That was more of a hobby. But I just kind of continued to take those courses throughout just so I could have that as an option maybe to fall back on. And then in grade 12, I'm sure you guys took this course too, the exercise science kinesiology course. Yeah.
The 69.
Yeah. The one with the textbook with Ben Johnson on it. I don't know if you guys yeah, that course. And I was actually told, like, don't take that course, man. It's super hard. Like, you got to learn all these randoms, insertions, origins, like these muscles that like crazy Latin names. And I'm like, you know what, like, let's just go for it. I took that. Literally within a month, I just completely switched my whole life path. And I was like, don't want to be a lawyer anymore. I don't want to be a teacher. I don't know what I want to do, but I want to do something with this. And I feel like if I didn't do something with that, I would kind of be upset with myself. And eventually I would kind of go off the rails and do something with the human body. So, yeah, I ended up going in kin. I took physiology, anatomy, all those courses. And then I decided to just walk into a physio clinic one day, see what it was all about, and was sold right away. I just loved the job, loved how you could interact with people all day, get people back to doing what they want. And yeah, no, it just really resonated with me. So
it's interesting, like, hearing your story, because I feel like it's actually a lot of people's story. You know, I hope I don't offend people by saying it, but I feel like most people don't grow up wanting to be a physio. You kind of like, you almost like arrive at that after you realize, okay, like, I really like interacting with people. I really like although law is obviously not that similar, but it's still got some parallels as far as like critically thinking and reasoning and that sort of thing, like making an argument for why you might go a certain direction. And then the teaching thing is, I feel like, actually very common.
Yeah.
for sure.
A lot of what we do is we try to not teach in a preachy way, but it's a lot of trying to help people understand what's going on with their body, and then you kind of put that all together, and it's like, and then with like a will to like help people, and that's kind of how you end up arriving. So I feel like the story is actually it's actually surprisingly similar to a lot of other people's, I think.
Yeah, I would agree. I think like we've talked about it before too, is like, it just, physio offers like a platform for you to take all of those things and put them together, right? Like you can educate, you can coach, you can interact with people on a daily, you can use fitness and movement and all of that as a means to help people. I think it just offers an awesome avenue for you to use all of those skills. One question I had for you though is like, going into physio school, you probably had a mindset of like what physio was. How has that changed from that first point, like going in, to where you are now, finishing up your second year?
Yeah, no, for sure. So definitely I thought it was, I didn't think it was as versatile as it is now that I know all about it. Like, man, like we are everywhere, like I didn't know that we were involved in like the treatment of people who may have cancer, and cardiorespiratory disorders, palliative care, home care, long-term care homes, retirement homes. Like, we are everywhere. I honestly, going in, just thought, private practice, MSK clinic. And I feel like that's generally what the general population thinks too. I knew they were in hospitals. I wasn't too sure, what they did. You guys know Parkwood Hospital in London. So I volunteered there because I wanted to kind of get more of a grasp on what physios actually do in hospitals. And yeah, even after volunteering, I still didn't really know. I was in like the neurological population, but I just wasn't sure like what was going on. But now that I've been through it all and I've actually been on the other end, going on placement in hospitals and clinics, and just learning about all these other settings, it's crazy how versatile the profession is. And that's what's really come to the forefront of my mind for where I was at the beginning of the profession, the beginning of the program, to just finishing up soon.
Yeah.
It's a good point, because even within one specific area of practice, there's so many different avenues you could pursue. Right. Like, obviously we usually talk about MSK, but even within there, right, like there's so many different types of areas that you could practice in. And even with the rehab, there's like spinal cord, there's stroke, there's amputee, like there's all these different areas that like you, when I went into physio, I had no idea that half of those existed. And I think that's one of the cool things is like, you realize like you're not necessarily limited. You can kind of you can even create your own kind of area, your own kind of niche.
Yeah, for sure. Let's talk about physio school, man. Like, give us, I know you probably can't put it, we could be here for hours, but give us a little bit of like a brief overview of like your experience so far. What have been some things that you like really enjoyed? What are some things that, you know, you wish you could do differently or would be done differently? Just give us a little bit of that.
Yeah, for sure. So the one thing that I love about physio school is kind of that transition from undergrad, where undergrad you're taking those courses that you like, you know, and can, especially when you're in the upper years, you can take maybe some rehab science courses or some courses that are geared more towards MSK or things that are related to physio. But you also have to take some of those random electives too, you know, like maybe you took a Greek Roman mythology course or a random you know, like a random prerequisite that you didn't want to take. So it wasn't like you were learning all the things that you wanted to learn to kind of put into practice in the future. Whereas physio, everything you're learning is exactly what like I've been dying to learn since I was kind of in that third, fourth year of undergrad. And yeah, it's cool because I kind of feel like now being in physio school, this is going to sound weird, but like now that I have like a purpose almost, like I feel like I'm going to be out there soon in life, you know, just being a contributing member of society, being able to have skills and knowledge that will be able to help people. Whereas like coming out of undergrad, I don't know if you guys felt the same way, but you kind of just felt like you were a person who had a lot of random knowledge about things, but not a lot of practical skills.
Yeah.
Whereas now, yeah, that's what I love about physio school, because I feel like I can actually, you know, use these skills that I learn in class to kind of help people. Mm-hmm. And then just about the physio school that I go to, like I love Queens just in general is a great school. Yeah, Kingston in general is it's a great city. I love how small it is. It's a very tight knit community, and it's great for students. And then lastly, I'd say it's just the class too. It's nice being with a group of, I don't know how much it is, like 74 students who are all like-minded, all kind of have the same aspirations and goals as you. And just, again, being a tight-knit group where everybody gets along. So it makes a huge difference being able to be in a class with people like that.
Yeah, no, you make a good point with the undergrad thing, and then like going into physio school and you finally start to learn, you know, skills that you feel like you can actually translate. And then once you start going on placement and you're able to start to utilize some of those things that you learn in school into clinical practice, you're like, oh wow, like I'm actually making a difference with the people that you're working with. That definitely is something that like we felt. And then, I mean, I'm curious, we'll talk about it a little bit later, but like what we noticed is like once we actually started doing like our Instagram content and our podcast and stuff, we started even feeling more of that purpose as students, like taking that information that we were learning and helping other people. I think sometimes for me personally, what happened in school is like I'm getting bombarded with all this information like so fast, and you're trying to figure out like, how am I going to utilize this? Like, how am I actually going to have an impact? And then once you're able to like start actually using that knowledge to help other people, you're like, it gives you that sense of purpose, which I think is huge to have, because sometimes during school you can get to those dark places where you're like, you're getting all that homework, you got all those midterms, you're like, there's no way I'm going to remember all this stuff, and you're like, you feel like, all right, I need something to spark my day.
Yeah, 100%, man, 100%.
And then, like, given that, then, you know, what was it like for people? There might be some people who haven't gone through that, right? So, you know, getting set up for placement, like what is getting set up for a placement like? And then once you're on placement, you know, what was your transition like? You know, was it difficult at first? Was it, you know, exactly what you expected?
Yeah, so I think for me, it depended on the type of placement. So my first placement was private practice, MSK, exactly what I wanted and exactly what I was like super excited to go into. And for me, for that placement, I guess contrary to most students, like I wasn't really nervous. Like I was eager to get in there because just going back to Western, like I think Western really prepared me well for orthopedics. You know, like one thing I haven't mentioned was back when I was in my fourth year, I had the privilege of being a varsity trainer for the Western's men's basketball team. And I learned a lot of the exact same clinical skills and special tests, basic MSK assessment from basically starting in, I'd say, the second half of second year at Western and continued third year and fourth year. So I felt like I was already pretty well versed in that stuff. So just getting out there, it was just about, being a physio, knowing how to assess the person in front of me, managing my time, being able to chart, things like that. But I was really eager to just go out there and just start going with that. But I'd say my second placement, where I was in the hospital and I was doing neuro, that's the one I was kind of nervous about, because honestly, I still didn't have a good understanding of a physio's role, especially dealing with, a neurological population or even a cardiorespiratory population. I only really knew MSK, and I was, especially in terms of treatment and assessment, like I was like, what am I supposed to be looking for here, really? Like, yes, and especially treatment. Like some days I didn't know what to do with people. Like I would honestly just go for a walk and talk for like an hour.
I'm laughing because like that's the same experience. Like, when I went on my first acute care placement, man, I remember just being so wide-eyed, dude. Just like, all right, let's do this. Then I'm like, oh wait, what do we do? And then this guy's like, oh, you got to read the chart. And you're like, okay, I'll read the chart. Like, I don't know. it's
so true, man. So true.
But I think that's important for people to realize is like everybody has their areas where they're not as strong in, and it's very natural to go on those placements and feel nervous and stuff. I think like you just got to be open to hearing people's thoughts and advice, and just trying to like, understand that you're not going to know it all, and you're not going to be amazing right away. And like, it's a process, and you may not ever get to that point with certain areas, I still don't feel confident about my ability to go in a hospital and be a cardio rest therapist, that's just how it is.
But, and I'm sure you can comment, by the end of the placement, like you felt comfortable, at least comfortable enough to be like, okay, I can go into I can go into a room. I know how to set up the room. I know how to assess. I know some treatment that I can implement. Like by the end of it, you get a grasp on it.
For sure, man. 100%. Like I felt like now during assessment, I knew what to look for. A lot of it was about, just figuring out what the person's home environment was, because we need to discharge these people and then make sure that within their home environment, they're safe. And then that would help guide our treatment. If they had stairs, we got to make sure that they're good with that. And just certain things that may be barriers to them in their home environment. We just got to make sure that we really hone in on those things. And then, I felt like I could handle it by myself. Like even my CI would some days just be like, hey, not coming in today, like wife's sick or something like that.
You got it, John, go for it.
So no, but definitely by the end of it was definitely a good experience. Like I don't see myself practicing in those areas, but it's good to get that experience and gain an understanding of what it's like day to day and how to treat and how to assess things like that.
100%. Yeah.
I think it's cool what you're pointing out too, because a lot of stuff that you just pointed out, like the home environment and stuff like that, like you realize that you're not treating people's pathologies and people's what they come in with. You're treating them in context and the environment that they live in and the goals that they have. And so if you get a lot of that info, usually regardless of where you are, that's going to gear you towards what you need to do and what you need to work on. So that's actually, I feel like, a huge thing that has been helpful for us is looking into those things as much as we can, instead of just being like, oh, okay, well, this person has X condition. Like, what do I do for that? What do I assess for that?
Yeah, it goes back to function, man. Like, because I was always like, okay, they have this condition. Like, say, for example, it's a brain injury or something. It's like, what do I do to like fix it? Like that's because that's what you think MSK wise, but it's not that you're trying to fix the pathology. You're just, you're trying to give them a better quality of life. You're trying to, make sure that they can function properly in their environment. And you kind of got to shift your focus to the function side of things as opposed to, like you were saying, the pathology.
Yeah. So you're currently on your third placement right now. Is that where you're at?
Yeah. Third placement right now.
All right. So what are you doing for that?
So I'm in Bowmanville. That's why I'm living in Oshawa right now. So it's about a 15-minute drive to the clinic every day, but it's a private MSK again. I kind of wanted to do acute just to get all the requirements for the program, but I was super excited to get back into the clinic, honestly. It's a great clinic. It's basically me and my CI there. She's an unreal CI. She really gives me a lot of freedom. Seems like she trusts me a lot. And I just finished the second week out of 6, and we're basically already splitting the caseload. So she's awesome, man. Like
Yeah, let's talk a little bit about that. Like you say she's awesome. Like she's good. What do you think? To you, what is like a good CI? What do they provide you as a student?
Mm-hmm. So, I guess like one thing is definitely during assessments, they kind of let you just do your thing. Nice. And they'll only step in really if maybe they think there's a safety concern, and a lot of it's their body language too. When you're like maybe doing a subjective or whatever, and you're in that time crunch of like, it's like 30 minutes, but maybe you only have about 15 minutes to do the subjective and then 15 to do the objective. And then, if you're maybe taking a bit too long on the subjective, you can kind of see in the corner of your eye, like your CI is kind of like fidgeting around, or maybe taking a deep breath and like they just look very impatient. Like she's not like that at all. She really just kind of chills, and I don't feel like I'm rushed. I don't feel like, I don't know, like I'm asking the wrong questions, things like that, because it's a subjective is supposed to be very open too. Like maybe she wouldn't have asked the same questions that I would have, but it doesn't mean that because I asked, it doesn't mean it's wrong per se, And then, she lets me just jump right in. And then she kind of lets me explain to the patients what's going on and then what we should do from there, as opposed to just taking it over and not letting me learn from whatever mistake I may make. And I'm sure you guys has experienced like, those dumb mistakes that you make on placement. You gotta make those mistakes. You gotta go through it, because the next time you're faced with that situation where you made that mistake in previously, God knows you're not going to do that same mistake again. So
right,
good to just be open with the student, just let them do what they got to do,
Yeah, for sure.
It's a good point, because a lot of like the subjective history and ways to explain things to patients can be done so many different ways, like you mentioned. And it's hard when you have people that want it a very specific way and aren't willing to let you kind of develop your own style. So I feel like that's definitely a really good point, that to let people kind of like figure out like how they want to go out of subjective. It doesn't mean you can't like consult after and kind of talk about, okay, like what do you think went well, what do you think maybe you could do a little bit better, but having the opportunity to explore different ways to teach people things, even if they seem a little bit different, and have your reasoning process explained and stuff like that, I think is really important for students.
Yeah, for sure. That's something that when I had CIs that were like that, it was the best learning environment for me, because they allowed you to like Will said, find yourself. But then I think the most important part is to have that dialogue after, where you're able to explain like your thinking, and then they can take what they know and add on to it or give their input. And that's like just fosters that learning environment the best, I think, personally.
Yeah, 100%. And like, I think one thing all CI should do is like, kind of use that sandwich method when they're given feedback, say what you did well, and then in the middle kind of say, okay, maybe you could have improved on this, and then end off with a positive thing. But you know what? You're doing well at this too, because it doesn't make it seem like they're just grilling you. Like, you got to be able to do this. You got to be able to do that. You're doing this bad. You know, they're still pointing out the positives, but they're saying you could also work on this.
For sure. Doesn't just crush you down and you feel like you can't do anything.
Exactly.
Like, all right, I'm checking out and I'm just opening the coffee shop. That was like what me and Willie said. Like, you know what? Like, if we got it, we'll just check out and just open a coffee shop.
That's during those bad days where you're just like, oh, this was not a good day on placement. This was brutal.
All right, let's get into the good stuff, man. Let's get into the YouTube channel that you started. Let people know what that is. Explain it a little bit for those who don't know what you're doing.
Okay, for sure. So, back in, I guess, just this past summer, kind of in June, July area, I started thinking about myself that I wanted to maybe start a YouTube channel. And I wanted to start kind of an informative YouTube channel for both future and current physiotherapy students in Canada, because both future and current physio students, they face a lot of challenges, whether it be getting into school or, you know, being successful when you finally get in. And I felt like I was in a great position to kind of address those needs. And especially for the students who are trying to get in. You know, I remember back when I was trying to get in, you guys may have the same thoughts, where I felt like there wasn't a lot of information out there in terms of, you know, what do my marks have to be? Like, what am I going to write on a personal statement? What work and volunteer experience should I have, whether that be physio related or non-physio related? And why should I have those experiences? You know, how do I get a professional and academic reference? Like, how do I go about doing these things? And I felt like if I didn't reach out to people who were in physio school, because I knew like a couple people were in physio school, and I didn't kind of pick up those mentors throughout my process of getting in, like, I would not have known any of that. I was also, you know, surfing that, I don't know if you guys have seen that Pre-Med 101 forum where people post, you know, their GPA, their experiences, things like that. A lot of people don't use that, but there are still a good amount of people who use that, and they all kind of have the same concerns as me. And I was like, wow, like, I'm not the only one in this. Like, everyone else is kind of confused on, you know, what you should do for getting into physio school. So I saw that, kind of kept that in the back of my head, and then eventually I was successful in the process. So obviously did something right to get on. And then, just going through physio school too. Like, you know, you guys talk about it a lot on this podcast. You talked about some of maybe the struggles you've had throughout physio school, and what you've kind of done to reconcile those struggles. And again, I just kind of put those in the back of my head, and then I kind of just merged all that with the fact that I've always kind of wanted to do YouTube. You know, I felt like I kind of had the personality for it, whatever that means specifically. And I just started drafting up a plan. I thought it was actually funny. I think you guys posted this maybe a couple months ago about your plan that you guys wrote up to do the podcast. Like, I did the exact same thing for mine. Like, when I saw you guys post that, I thought that was incredible.
That's right.
But I started just drafting up some video plans and started thinking about those concerns that I had, some of those concerns that I see all the time online. And when people ask me, hey man, like, what should I write on this personal statement? Like, what were your marks? What should my marks be like? Things like that. And I was like, you know what? YouTube's such a good way to kind of get those concerns across and kind of address those concerns. So I just went for it.
Yeah, man, that's awesome. Like, one, it pumps us up that you're doing something like that, because obviously we're involved in, you know, putting out content and doing that stuff, and it fires us up that more students are trying to make a difference in their own way. And I think what you're doing is super important, because obviously we sat in the same position and had all of those same thoughts. And I think it's important to talk about the GPA and the personal statements and all of that stuff. Like, that's 100% helpful. But the thing that I like that you're doing is you're giving people as much insight as you can into what the process of physiotherapy school is actually like. And I think that's key, because I think when I was going into it, it was a big unknown. Like, I was excited, like I wanted to go into it, but I didn't really know exactly what it was. And I think by giving people a better idea of like what you're going through and how it's set up and what you're learning can allow people to like maybe synthesize like, oh, maybe I don't, or maybe I really do want to do this, or maybe I don't, maybe I didn't think it was what it was. Like, I think giving more people information about it is important, because it's like, it's a grind. If you get in school, it's a lot of money. And if you don't actually want to do it, like, it will be a lot on you. Like, it'll crush you down. You know what I mean? Because you'll be like, I don't really want to be here, and I'm getting all this homework and all these things, and it's just easy to get down. So I think that's awesome that you're providing that insight for people.
Yeah, I like that you brought that point up too, because I see a lot of these vlogs and like a lot of these channels from students of other programs like law, med, MBA, things like that. And they do those day in the life type videos. And for somebody who wants to go into those programs, it's only kind of a snippet of what their life is like, but just that snippet can sometimes mean a lot to people.
Yeah.
And from seeing those other programs, I did some research myself, and I was like, okay, is there something like this for physio students? Like, this would have been awesome when I was applying, just to see something like this. And I searched, and I could only find ones from the US and the UK and some other countries, but literally could not find one from Canada. And as soon as I saw that there was an opening there, I was like, man, like,
go for it.
I got to pursue this. Like, it was just an opportunity right there. And I was like, may as well do this. Cause I think for us, like if we were going back and we were applying like maybe a few years ago, and we saw, a kid from the US in physio school doing like a day in the life kind of thing. Yeah, it'd be cool, because you're like, okay, that's a physio student, but you'd be like, I'd like to see one in Canada, like, I'm going to a school in Canada. It'd be nice to see it from the perspective of a student in Canada. Those are my thoughts. So, as soon as I saw that opening, I was like, yeah, I should definitely do something like this, because I think it would add a lot of value to a lot of people who want to get in.
It's cool. I'm curious because like we've obviously had some similar experiences, but people see the outcome, right? They don't see the process.
Oh.
So I'm curious, like, what have been some of the most, rewarding parts, like best things that have happened throughout the process? And then what are some of the like challenges that you might have faced that people may not actually see?
Yeah, I really like this question, actually. So kind of the rewarding parts is I've gotten some people DMing me, some random people that I don't know, saying, hey man, like, I'm a student, like I'm an undergrad right now in like a X school in Ontario, and I've seen your content, man, and I just want to let you know, like, just keep doing that. Like, I love this stuff. I'm really excited for, the tip videos, things like that. I applied last year, I didn't get in, and I'm hoping that maybe some of the content you put out there will really help me and help me see things that maybe I didn't see before, because maybe they didn't have the right guidance or the right mentorship to kind of put them in the best position possible to get into physio school. So that 100% has definitely been rewarding for me. And you guys have probably experienced the same thing. Like, when you get those DMs from random people, just saying that they like what you're doing, it just gives you that extra boost of motivation. Like, kind of gives you those goosebumps too.
Yeah.
Because you feel like you're doing something for somebody.
Mm-hmm.
You are doing something for someone.
Yeah, exactly. And like, you're already intrinsically motivated enough, but just having that extra boost is definitely valuable too.
Yeah, that's the key, man. I don't want to interrupt you, but like, you hit it right there. Like,
yeah,
the intrinsic motivation that you have to like generally make a difference. And then when you get that external like reward from someone saying, hey, I really appreciate this content that you're putting out, it's helped me do this, it just gives you that so much more of a drive to do what you're doing. Wow, too much coffee and too hyped up. rather when you're doing it for the wrong reasons, like, you don't get that, like, if you're just going for followers, or you're just going to like build a brand to make money, like, it's not the same when you get that like reward from that person saying that. But like, when you have that intrinsic motivation, it's just so fire when you get that stuff.
Oh yeah. And if you don't have the intrinsic, like, you'll eventually fall off. Like, you'll do it for a bit, but eventually you're just not going to have that motivation to do it anymore. So it's got to come from within, and like you genuinely got to want to add some value to people's lives. So, but yeah, I guess to address the challenges now too. The number one challenge, I think, and I think you guys can kind of relate to this too, was starting it. Just actually going through, I had the plan drafted. I had like a 20-page Word document on this stuff, like so many videos planned for the future. And then I made my first video, edited everything, ready to upload. And I kind of just had it sitting there for like 2 weeks. And I was like, man, do I really want to do this? Like, do I really want to put myself out there? I know like my intentions to help people out, those weren't being questioned whatsoever. It was just kind of putting myself out there. And I was like, man, like, what are people going to think? Like, are they going to think I'm weird? Things like that, like all these thoughts go through your head. Yeah, I don't know. Just talking with a lot of my friends and just really thinking about it over and over again. I know you guys watch Gary Vee. Yeah. Started watching him a lot, like basically consuming his content every single day. And he says all the right things. And once you actually kind of put what he says into action, everything else just falls into place. He's so bang on with everything. And yeah, I feel like kind of putting that content in front of my face all the time, every single day throughout the summer. And then just finally being like, okay, you know what? I'm just going to do it. And I released it. And it was great to just finally get it out there, because I felt like I got a pretty positive response to it. And it's been great ever since.
Yeah. I'm curious to take us through like that fear of putting yourself out there, and then you do it. Like you put yourself out there, and then how did the process like after that go for you? Like, were you still doubting yourself at times? Like, were you still questioning why you were doing it? Or was it like kind of that switch where you're like, all right, screw it. I put myself out there. I'm just going to keep going. And like, no matter the responses that I get, I'm just going to grind through it and just go with my vision.
Yeah. So honestly, probably both of those things. So once I put it out, sorry, I got that relief, like it's out there and here we go. Like we're ready to go. Now I got to start following through with everything else that I've had planned. And then, sorry, I lost my train of thought here. Yeah. But I thought like, yeah, I just got to keep going with this. And, what was the second thing you said? Sorry.
No, it's okay. Like
it's almost like a snowball effect is what you're saying. Like once you get the ball rolling, like you kind of, you're forcing yourself to keep going then. And you get into a bit of a rhythm, I think, with that sort of thing.
Okay. Yeah.
Start.
Yeah. And then, sorry, you were talking about the doubts.
Yeah.
So yeah, definitely had those doubts, later on. I was like, you just have like a bad day or something. You're like, why am I doing this? Like, is this really kind of matching up with my vision that I had previously? Or is this just going to kind of flop, But yeah, no, I just kind of kept my head down, kept working. And if you just keep doing that and kind of get through that adversity a bit, it all pays off in the end.
Yeah, it happened to us. It still happens to us. It's like you're riding a wave, man. Like you're going up, you're going down. And I think, again, coming like a little bit full circle with what we just talked about having that intrinsic motivation and having those values and having that vision of what you want to do. Like when you have that behind you, it makes those times where like you're in those dark places easier to come through. Like if you don't have that solid thing to back what you're doing, it's easy, like you said, to just give up and quit, And I think, again, getting that feedback from people, like you have to really latch onto that positive feedback when you get someone saying, I really appreciate your content, or you have other people around you that are like supporting you. Like you really need to latch onto that, because you know that like you're impacting someone. And if you're impacting, like we took it as like, if we're impacting one person, then we're doing something, you know what I mean?
Sure.
Like we're helping someone. And I think that's what's helped us through like the ups and downs. Cause like we still get to that point where we're like questioning, like, what are we doing? Like, why are we doing it? Should we be doing this? Those are all like natural thoughts. And I think people need to understand that, like, if they're embarking on something like this, that's totally normal.
Yeah. 100%. Like you're going to go through it. And I think, you guys have probably experienced it too. Like your first, I don't know, maybe few first podcasts or posts that you put out there, it's pretty nerve wracking because you're like, what's the response going to be like? But after that, like you kind of just throw it out there and you don't really have, you don't really have a second thought about it. Like, man, like I just throw out videos and I don't even think about it anymore. You know, I watch it just to make sure that the edits are right and, you know, everything's kind of well explained. I didn't make a mistake in that process, especially like, you know, those pop-ups that I have. I want to make sure that I spelled everything right. But in terms of, you know, like I don't really care. Like if somebody thinks I'm weird or, you know, I look funny, like those are things I can't really change about myself. So
that's right. You stop judging yourself, man.
I really did, man. Like it's that level of personal growth that I've had in terms of that. Just being able to throw something out there, throw a piece of content out there and not have a second thought, like that's a great feeling.
That's hype, man, because that's what it's about, right? Like even if like the learning experience that you get from it is so much bigger than what you're actually doing. Like if your YouTube channel was to explode, like for whatever reason, like I'm sure the stuff that you've learned from this point, from when you started, is so valuable to you going forward in your profession, in your life. That like, because it was like that for us, that's like it's not about that, like it's not really about the actual like subscribers and stuff. Like that's nice, like that's cool, that's fun, but it's about what you just said, and that's cool that like you're experiencing that.
Well, and you know, realizing also that like that toughest part's starting, and that along the way you can adjust, you know, you can pivot, you can change, you know, you don't have to stay the exact same the whole way. So, you know, that mirrors everything in how you would be a physiotherapist too, you know, like that first assessment, the toughest part's getting started. But the plan that you kind of set and forth can change, you know, as you go. I think that's a big thing, is like, you don't have to have it all figured out right away.
Yeah.
And when you start something like that, like you get better at just being like, oh, okay, well, maybe I can adjust this. Like maybe I can change this. And it becomes more natural and easy for you to do that.
Yeah, for sure. And that, like, I experienced that just making videos in general, just talking in front of the camera. Like that first video was so tough for me to make. Like probably 2 weeks before I made that, I was just practicing talking in front of my phone camera because dude, it's so unnatural talking to a device with no one else in the room.
You want a good laugh, man? Like we're going to have to do a series on our Instagram page of like our very first videos from like our Instagram. Like if you want to laugh, man, scroll all the way down to the end of our Instagram page and watch some of the videos. Oh my God. I'm just like, man, I think even some of the stuff we were putting out, I'm like, man, if like some of the people that we're involved with right now like saw that, they'd be like, yo, what are you talking about, man? But it's cool because it shows how you can evolve, right? Like it shows, and that's the essence of being a physiotherapist, like in a profession that is constantly growing, constantly finding new research. Like you have to adapt, you have to grow. And like, if you're able to do that, like you're going to have success. If you're not, if you're so caught up in it in like one thing and you're not able to have that growth mindset, like it's not going to work out. And I think these platforms and these conversations are allowing that truth to come out, and it's going to help our profession immensely. And some people are looking at it as a negative, and I think it's so positive. I think it's going to help push our profession forward. And if we embrace it, it's going to make us better.
100%, man.
All right, I'm getting freaking hyped up, man. All right, let's talk about coffee. How do you brew your coffee?
So right now I'm using this Toastmaster drip coffee maker that we have in our, I guess, Airbnb Oshawa home. And I'm using Dirkson's North Roast Coffee Mayan Fusion Medium Dark Roast.
Woo!
Some good stuff. Some good stuff. And yeah, I take it black.
Yes.
Right on.
Again, we like all coffee, but we love the great coffee.
Yeah, exactly.
As we're drinking Tim Hortons, but that's like classic Canadian, so we're okay.
Fun fact, I used to work at Tim Hortons back in high school. So
nice. No, we like have this common saying, like we always say, it's like all coffee's good coffee, but some coffee's great.
Oh yeah, 100%. When I was in Brazil, because my like half my heritage is Brazilian. The coffee there is just unbelievable, man.
Ooh,
Just the fresh beans, you know?
Yeah.
that'd be cool getting it right from the source.
Yeah.
Oh, right from there.
You just go pick it. You can just do that off the tree. Is it
Well,
on the tree?
I don't think it would work like they're like cherries.
I know. You just pick it and just eat it.
I did see. I was looking at this Airbnb you can stay in Costa Rica. That's literally on a coffee ranch.
Nice.
Oh,
I was like,
that's where you guys got to film. That's where you guys got to record your podcasts.
That's right. Yeah, we're coming for you.
So I mean, you're coming. Like you're in your second year. You're what, halfway through now? Just about.
Yeah, just about halfway.
What's the plans for the page, or sorry, the channel once you're done? And then what are some of your plans like once you graduate?
Yeah, so the one about the channel, I get this question a lot because everyone's always like, you know, your name's the Canadian Physio Student, but like you're not going to be a student forever, you know? Like, are you going to be the Canadian physiotherapist or something? Like what's going to happen? And honestly, like just going back to the goal and the vision, like my whole reason why I started it is just to get the information out there. And if it's just chilling, you know, on YouTube 10 years after I'm done with it, that's fine for me because that's always going to be there for somebody to use. Obviously things are going to change, but you know, things won't change too much, especially in terms of, you know, getting a reference, writing a personal statement. And then I don't know if you guys have seen some of the interviews I do. They're pretty similar to what you guys do here, like talking about, you know, it's a misnomer, but soft skills. And then I got some other ones planned in the future, just to talk about certain topics in physiotherapy. Like those are always going to be relevant. And yeah, like I guess once I'm done being a student, maybe I'll start something up. Maybe I'll get into the podcast game too. Who knows?
Yeah.
You know, like maybe I definitely want to continue with something on social media, whether it's Instagram, whether to continue with YouTube, maybe do podcasts. I want to do something, but I'm not really too focused on that right now. I just want to kind of focus on what I got going right now. And then from there, I'll, I guess, devise a plan.
Sweet.
Yeah. And then I guess for me personally, just kind of going with the flow right now. You know, I'm just trying to be more opportunity oriented because there's so many things that can change. You know, like we've all experienced whether major or minor changes in our life. And like, you may be on this path thinking, okay, I'm going to end up at this destination. I'm going to do this, but something can just 180 on you in a second. And then all of a sudden you're changed. So I'm not trying to make, I guess, specific plans, but I have kind of a pool of things that I want to do in the future. You know, I definitely want to work in private practice, maybe open up my own clinic in the future. I'd love to live in BC. I went there the last couple summers and just honestly fell in love with the place. It's like the California of Canada. I just love, you know, the nature there, the hikes, all that's pretty active lifestyle out there. So yeah, I guess that's what it is for me personally right now.
Yeah, you can go out with isn't Alex from BC?
Oh yeah.
Yeah, go out there and crush it with him, deadlifts and treating people all day, drinking
For
coffee.
sure. Yeah. He'll open up the CrossFit gym and then we'll have the physio clinic attached to there.
There you go, man. The dream.
We're living it.
Cool, man. I think that's pretty good. I really appreciate what you're doing. I think I would have liked to have had those videos before I got into physiotherapy school, and it's really a beneficial thing for people to look into. So good on you for starting it. You know, we're both pumped up about it, and I think lots of people are going to benefit from the content that you're creating. So good job making that.
Thanks, man. Really appreciate that. Love to hear that feedback.
Yeah, man. Do you have anything else you want to talk about?
I guess just general advice to give to future students out there.
Give it. Go for it.
You know, maybe going into physio school in the future. Like you guys said, you're just going to be bombarded with information, especially things like clinical skills and all that. It's going to be tough. You know, you're not going to know it all at once, especially when you get out to placement, you're going to forget things. But just know, like, those clinical skills, like, they're going to they'll fall in place one day. Like, you're going to know how to do all that stuff. But I think the number one thing is just working on being a people person and just really being able to connect with your clients, things like that, because a lot of it does have to do with whether the client likes you or not, and whether they, buy into what you're saying. So I think definitely just picking up experiences here or there, learning about a bunch of different people from different walks of life can really help you with the social aspect of the job too.
Yeah, man. Dope. Sweet. Yeah. Awesome.
Other than that, pretty much it.
All right, man. Give a shout out to your YouTube, where they can watch it, your Instagram, Facebook, whatever you got going.
Yeah. So YouTube, just go on the YouTube search bar, the Canadian Physio Student. If you want to see my Instagram, I got some complimentary content on there. It's at CDN Physio Student. And yeah, just hope you guys can come along the ride with me. Yeah. Maybe you guys can get a feature on the channel too one day. Maybe we could.
Do it. Yeah.
I'm down for that.
Sweet. All right, man. Thanks for coming on. Like, again, we really appreciate you taking the time out of like your day, and I know you're on placement and stuff, to chat with us. We really appreciate what you're doing. It's awesome. It fires us up. So keep crushing it, man.
Thanks, man.
All right.
Thanks for having me on.
All right. Peace.
Seriously.